It will impact Medicare. The way this bill is set up, it talks about a health insurance exchange. That private insurance companies, along with the so-called public option, would go into this exchange from which people would have the ability to buy insurance. There's a problem, though, because of the language that deals with private insurance. First of all, individual plans that a person has, well, if that company issues individual plans, they would be grandfathered. They can't issue any more individual plans, period.
Individual as in an individual goes into the market to
Yes.
purchase one policy?
That's correct. Thank you for that. Now, if a company cannot offer individual plans anymore and get new enrollees, what's going to happen? They'll be out of business. Second of all, under section 161, a private plan must remit to the insured any excess of premium payments minus what the insurance companies pay out. What that means, it leaves no room for any profit margin, and therefore that means that a private insurance company simply cannot can't stick around. Section 222, premiums and financing of public option. The commissioner sets rates. He's called the Health Choices Commissioner. Sets rates at a level sufficient to fully finance the cost of health care provided in the public option and administrative costs. Now, this is this bureaucrat that sets the prices in the public option. Are you with me? Mm-hmm. Okay. The same commissioner also comes up with the coverages and the extent of coverages for all plans that compete on this exchange. So everything that's offered will be the same coverage, unless you come into one of those plans that somehow gets grandfathered, that has coverages that are different. That will stay free of this until they make any change in copay, any change in coverage. The slightest change, that company loses its grandfathering. They're put back into the exchange. Then they must come under the same coverages and the extent of those coverages that any other company does. Now, what happens here is the public option won't pay taxes or have large administrative costs because the rates of the public option, are you ready for this, are Medicare rates. This is very important. The Medicare rates plus 5% for the first 3 years of the plan. There's no way a private insurance company can compete in rates when the public option payment is Medicare, because Medicare rates are too low. And today, a hospital, for example, will get a Medicare reimbursement rate and then have to cost shift that to people that actually have insurance, and insurance rates pay more. Today, the average family pays $1,800 in additional private insurance rates in order to subsidize the present Medicare payments. Are you with me?
Yes.
Okay. The section 311 and 313 is an employer must offer a qualified health benefit plan to all employees. Okay. Now, two things happen here. The employee is automatically enrolled in that health insurance policy that has the lowest cost to him. Well, guess what that would be? That's the public option. Okay, that's automatic enrollment. And so every new employee coming in has to go into that into that public option. And you reach a point where why would an employer want to have two different types of insurance? Are you ready for this? If an employer offers a qualified health benefit plan, and let's say I'm working for you. I guess I do. And what is your first name?
Mike.
Mike. Okay, Mike, you have a business, and let's say you have 20 employees. You say, Don, I've got a good health care plan. I've been studying this. We've been able to keep the rates reasonably, etc. And I say, you know what, Mike? My wife has got a job, got great coverage under her policy. I just really would like to opt out. Under this bill, the way HR 3200 is written, even though I'm not covered under your insurance, you have to pay the equivalent of my insurance to the health insurance exchange. I mean, we think about that. Well, then why would you want to keep your own policy and say, well, I'm paying for him and it's going to the health insurance exchange? It simply does not make sense. And then what happens is everything, here's your Medicare answer, everything then defaults to the public option. The public option rates of reimbursement are Medicare. I mean, that will overload the Medicare system. Medicare was never designed to cover everybody. It was always designed with two groups of people, seniors and people that were disabled. It's never been designed for anything more than that. The costs have always been more. In fact, I was working in 1965. I was going to school in Washington. I worked for John B. Anderson at the time. And Medicare came up. And the estimated cost in 1965 for Medicare in 1970 was $3.5 billion. It ran $7 billion. The estimated cost for Medicare in 1990 was $9 billion, and it ran $112 billion. Okay? So that's how it impacts everybody in Medicare, because everybody would end up with Medicare rates being paid to the medical providers. And so a system that already is in need of fixing, and Medicare's got a lot of problems, it overloads it. And that's why this bill has a lot of problems, and that's why seniors should be rightly concerned about the extent and nature of the coverage, because it will really hurt Medicare reimbursement.